Good morning, ladies and gentlemen. Thank you to give me the possibility to present you or give you a short overview about the Austrian eCard system. I will keep it short and simple. So, the company behind the Austrian eCard system is called SVC. The SVC was established in 2001, in the year when we decided to have a modern eHealth system in Austria, and is owned 100% by the main association of the Austrian social security institutions. The mission of the company was and is to establish, implement, operate and extend the ELSI, the electronic system for administration, using a multiple applicative smart card system within the field of the Austrian security, social security. Our company has three main branches. We have the eCard system. Also, we have as a branch the web portal of the social security called ESV. And the third main branch is a very young main branch, is the electronic health record, but we only develop parts of it, not the whole, because it's really a huge project. Our know-how consists in software development and system development. For example, we develop the whole software for the eCard system and the web portal for the social insurance. We have a bigger experience now with operating data center. It was a main effort. And we have a major experience in project management, especially with stakeholders from the private sector and the public sector. So, just a few words about the legal frame. In Austria, nearly 99% of the people are insured by the Austrian social insurance. In Austria, we have 21 different health insurance institutions, and these are covered by the one main social insurance institution. The main association of the Austrian social security was entrusted by law to replace step by step all administrative papers among based processes among the social security institutions and the other customers like patients, doctors, hospitals, or something like that. The problem is that every health insurance institution is self-administrated and so can decide by their own the processes and the paper forms they use. So just to bringing up this eCard system and to standardize everything in a digital way was a bigger effort, but even a bigger save of money and a bigger save of work, I have to say. And by law, a smart card was necessary, which should be functional also for e-government. This means that the card should be able to be activated as a citizen card. A citizen card is a combination of a qualified signature card and then a strong identification so that you can use it to identify yourself over the internet. And yeah. Good. About the smart card, this is our e-card. The design didn't change the last 12 years, and it seems that we will have it for 12 years longer. Yes, it's like a little bit of vintage look, but it has a high recognition level in the Austrian population. On the reverse side of the card, we have the EHIC, standard in the EU. On the front side of the card, you have only a few informations about the card sequence number, the social insurance number, optional and academic degree, and the first and last name, And then we have two letters SV, stays for Sozialversicherung, is the social insurance, in Braille, just to give the possibility to partly sighted or blind people to identify the card in the pocket, because usually every one of us has at least 10 or 12 cards in his pocket. On the reverse side, yes, there are the standard fields of the European health insurance card. On the chip, it is really a smart card chip. There is, yes, we have all the data that we already showed you. This means the data that you can read from the card. And there are some cryptographic keys, because it's a signature card, a smart card, and we have obviously some certificates. But the card itself is, the concept of the card is the concept of a key card. No information on the card, but the card is the key to reach the information that is stored in a central data center. The chip of the e-card, now we have already the 4th generation. The 1st generation never went in the field, but we have the 4th generation. We have a huge chip, about 300 kilobytes of solid flash. At the beginning, we were talking about 32 kilobytes. The chip provider is Infineon with a really high standard or high secure chip. As an encryption or as cryptographic algorithms, we decided to go on elliptic curves with a bit key length of 256 and a hash computing SHA-256. This should keep us on the safe side for, let's hope, a long time. Again, the keycard principle, the e-card contains only a few identification data. The e-card is not a carrier of application. The e-card is an access key to the system-based services. The access key is unique, obviously, and lost tokens are locked within the system immediately, so that fraudulent use of the card is not possible or not so easy. About the citizen card. The citizen card is, in my opinion, technically a great concept, but it's not really accepted by the population. Maybe it's a little bit too complex. The citizen card, already told, can be activated on the e-card for free. It's free of charge. Everyone in Austria that has an e-card can perform the activation processes over the web or go to a specific place. And you have a lot of, actually, you have a lot of applications that can be used with your citizen card. For example, the electronic old age pension account. You can have a look at your insurance data, or what happened with your e-card. You can see which doctor put the card in the card reader and something like that. And there are a lot of e-government applications like the annual tax declaration or getting the criminal record or the online banking. Now we have not even 50,000 active citizen cards on the e-card in Austria, but we have nearly 600,000 of the new kind of the citizen card, so they call it Handysignatur. It's like a mobile signature. And over the mobile signature, there were performed about 10 million of signatures in the last 4 years. It's quite, I think, it's quite good, I think. Another part of the e-card system is our CAMS, our CMS, the Cards and Application Management System. The CAMS has three major goals. Is the data preparation. This means that it prepares the data for personalization of a card. The data preparation means also to generate and derive all the cryptographic keys that afterwards will be stored on the card. and to prepare the data in a format that even the personalization center can work on. And yes, like the name said, the administration of the card to the card and all card applications for all issues, blockings and cancellation, and give the check status for signatures. This means that you have certificate revocation lists and OCSP services, so you can check the status of the certificate when you check or when you approve a signature. The major goal of the project was to build up an eCard infrastructure. In Austria, there already existed some networks, secure health networks, for example, hospitals or hospital unions, of course. The problem was that the physicians or the simple doctors, the family doctors, they were inside the network, and even we as the social insurance, we had our own network, but we didn't be part of this big network. So we provided with the GIN access, the GIN is the health network, now the new one with the eCard system, we connected a lot of health service providers like pharmacies, doctors, physicians, even our own network, and we combined all the secure or highly secure networks through the peering point to a nationwide health network that is highly secure and yeah. It's not a cloud, no. It's not a cloud, it's only a network. To ensure a secure communication between the physicians and our data center over the network, we installed or implemented a medical practice unit, the so-called GINA, and a LAN smart reader, and there is also a router, a specific router, and these three components you need to access the GIN. So the medical practice unit is, yes, it's individually developed embedded system. It hosts a lot of eCard application, but not the whole application, and in case of a network interruption, it can perform some stuff even in the offline mode. There are many solutions to use the GINA box, the medical practice unit. You can stick on a simple keyboard and the monitor, and you have an elementary graphical user interface just to perform your work. Or if you want, you can integrate it in your own network, in your private network. And so you can connect over a browser to the medical practice unit, and then you have a much nicer graphical user interface. And then you have also the possibility to interact with the medical practice units over a SOAP interface, so that you can integrate all the eCard processes even in your own medical software that you use. Yes, as already told, the Health Information Network, the GIN, and the peering point, it is high standards of IT security, quality, and availability, connects the most health service providers in Austria, and you need the three components, the GINA, the medical practice units, a card reader, and the router with the two inputs. And the peering point is where every secure health record joins each other in the middle. eCard services. In eCard services, we have to differ between the medical services and the administrative services. We began the whole story with an administrative service, and this was called KSE. It's electronic health insurance voucher. Just to explain, prior to the eCard system, as a normally worker, you had to go to the employer and ask for a voucher, a paper-based voucher. With this voucher, you went to the doctor and gave it to the doctor. You have to pay the voucher between 2 and 3 euros. The doctor then signed the voucher and wrote on every medication or something like that you get, and then had to send all this voucher in alphabetical order to the social insurance for a clearance. It's unbelievable, the process. And if you were sick in the weekend, for example, and you didn't have a voucher by your hand, you could go to the doctor, and then after you were at work again, you had to go to the employer, take the voucher, and bring it back to the doctor. So, and yes, the KSE is still our biggest application that we have. We have also some medical service, like for example, the medical approval service is also a very used service with about 2.4 million times per year. And yes, we have all value-added service. I'm out of time. So this is just a list of all the services that are already online for hospitals or for physicians. And at the bottom you will find 3 applications. They are not yet online, but they are, I guess, or I hope next year they will have this electronic approval and application service, and also very strong paper-based processes in the Social Security, e-prescription and ELGA token service. Just a few facts and figures. Since 2005, we produced 26.4 million of smart cards. Actually, we have 8.6 million active cards in the system. We have about nearly 10,000 physicians and doctors that has an e-card infrastructure with a medical practice units and so on. 160 hospitals are connected to the e-card system and 140 pharmacies. And since start of the e-card system, we had 1.2 billion of contacts between a patient and a doctor. Every month we have about 11 million of consultations. And the all-time high in one day was in 2011, it's over 700,000. Thank you for your attention.